If you're a cat person, you know that helpless feeling when your pet is in pain. Well, today we're going to tackle one of the absolute worst, most frustrating diseases out there, chronic gingivitis. But we're going to look at it through a totally new lens, a concept called the two-hit theory that might just change everything.
And yeah, this picture, it really says it all, doesn't it? We're not talking about just a little bit of gum irritation here. This is severe, non-stop inflammation that just seems to shrug off medication and causes constant pain. For years, the approach has been to fight the fire in the mouth. But what if we've been aiming the fire hose at the smoke while the real source of the blaze is hidden somewhere else entirely?
So let's treat this like the mystery it is. We're going to go on a little investigation to uncover what's really going on with what's called feline chronic gingivostomatitis, or FCGS for short.
So let's get really clear on what we're up against. FCGS is not your average dental issue. It's a full-blown, severe immune system assault on a cat's mouth. The words you really got to pay attention to here are chronic and notoriously difficult to treat. This is the stuff that drives cat owners and vets crazy, that feeling that no matter what you do, it just keeps coming back.
And that leads us to the central question, the real head-scratcher of this whole mystery. I mean, if the fire is clearly in the mouth and we're throwing everything we have directly at the mouth, why isn't it working? It just doesn't add up. And that paradox, well, that's a huge clue that we've probably been looking in the completely wrong spot.
All right, so here's our first major clue. And it doesn't come from the mouth. It comes from a place you might not expect at all, the gut. This is the gut-mouth connection. Now, to really get this, you have to wrap your head around this one mind-blowing fact. Get this. Over 70% of a cat's entire immune system, its whole defense force, is headquartered in its gut. That means the gut is basically mission control for how the body responds to threats, everywhere. And this isn't just some vague influence we're talking about. There's a direct superhighway called the gut-oral axis. The big idea here is to stop thinking of the gut and the mouth as two separate body parts. They're really just two ends of the same tube. They're a single, interconnected community, and trouble at one end spells disaster for the other. This diagram just lays it all out so perfectly. You can see the problem kicking off right down here in the damaged gut. But notice this. The inflammation and the toxins, they don't stay put. Nope. They travel right through the body and ignite a fire up in the oral cavity. The mouth isn't where the problem starts, it's just where it ends up.
So how exactly does a gut problem turn into a mouth nightmare? Well, it pretty much happens in 4 steps. First, the good and bad bacteria in the gut get all out of whack, and the bad guys take over. Second, these bad bacteria start to damage the gut lining, punching tiny holes in it. That's a condition we call leaky gut. Third, and this is the crucial part, toxins from those bacteria, specifically something called LPS, escape through those holes and get into the bloodstream. And finally, those toxins travel to the mouth, where they slam the panic button on the immune system, triggering that awful chronic inflammation.
Okay, so that brings us to the two-hit theory. You might be wondering, well, wait a minute. If a leaky gut is the problem, why don't all cats with gut issues get this horrible disease? That is an excellent question. And this theory, this is what solves that part of the mystery. At its core, the two-hit theory is actually pretty simple. It says that for a big, catastrophic chronic disease to erupt, you usually need 2 things to go wrong. First, you need what's called hit 1, a pre-existing vulnerability, some kind of weak spot that's just sitting there, waiting. Then you need hit 2, a trigger from the environment that comes along and sets the whole thing off.
This volcano analogy is just perfect. Think of the volcano itself as hit 1. It's this massive, dormant threat, a pre-existing vulnerability, right? It could sit there for 1,000 years and do nothing, but then, bam, the lightning strike. That's hit 2, that's the trigger. It strikes that vulnerable volcano, and the result is a violent destructive eruption, which, in our cases, is that horrible gingivitis.
Let's use another analogy, because this one really hits home. The loaded gun. Hit 1 loads the gun. For a cat, this might be its genetics, or maybe a past infection with a virus like calicovirus that left the immune system in the mouth permanently on high alert. So the gun is loaded, but it's still safe. Hit 2 is what pulls the trigger. That trigger is the flood of bacterial toxins, that LPS, from the leaky gut. And when those toxins hit an immune system that's already on a hair trigger, it doesn't just react, it explodes.
So let's put a face to the name. This is the trigger, lipopolysaccharide, or LPS. It's basically a piece of the outer wall of certain bad bacteria. Now, in a healthy gut, it stays contained. But in a leaky gut, these spiky little toxins get into the bloodstream, and act like millions of tiny alarm bells, telling the immune system to just attack, attack, attack.
So, when you combine the gut-oral axis with the two-hit theory, what you get is a vicious, self-perpetuating cycle. And this is what explains why this condition just doesn't seem to go away on its own.
So this is the really critical point. The cat's immune system, which is already primed and sensitive from hit 1, gets blasted by a constant stream of these LPS toxins from the gut. That's hit 2. The immune cells in the mouth become so overstimulated that they just go haywire. They lose the ability to tell the difference between friend and foe, and in this just tragic twist, they begin attacking the cat's own healthy gum tissue.
And this is what kicks off that awful, endless loop. The inflammation in the mouth causes intense pain, right? So the cat struggles to eat. Poor nutrition then makes the gut health even worse. A sicker gut, of course, leaks even more toxins into the blood, and those toxins go right back up to the mouth and fuel an even bigger, more painful fire. You see? It's a cycle that just keeps feeding on itself, which is why the condition is so chronic and so relentless.
When you put all these pieces together, it leads to a completely new way of thinking about this problem. It's a whole new paradigm for feline oral health.
For so long, we've been focused entirely on the mouth, scraping teeth, giving medications, even pulling teeth. But it turns out we've been looking in the wrong place. The painful, inflamed mouth isn't the source of the problem. It is the end result. It's the final, screaming symptom of a much deeper issue. And this quote just says it all perfectly. The inflamed mouth is a signal of a compromised gut barrier. It's not the fire, it's the fire alarm. It's a giant, blinking red light telling us that the gut's defenses have been breached. If you want to put out the fire in the mouth for good, you have to stop the fuel that's leaking from the gut.
So we end with this question, which is really the core idea of this entire new approach. For these poor cats, suffering from one of the most painful conditions imaginable, is it possible the key to finally bringing them peace and healing isn't in their mouth at all, but is hidden deep within their gut? Based on this evidence, the answer seems to be a resounding yes.